Hi, my name's Eddie and I'm an addict in recovery, and last week I celebrated 11 years abstinent. So how I was living in the past to how I'm living today is like night and day. I think there's a lot of frustration with people who are in recovery or in addiction regarding what support they weren't provided with, what information about recovery they weren't provided with when they did go for help. So I know for myself, sitting down with the trainee medics and being able to share my experience and thinking back to when I went to see my GP as well, hopefully the future medics will be able to offer that information that possibly, or I feel that I was looking for it that first time I went to my GP.
My name's Hugo. I'm a resident doctor working in the NHS, and I also run the organisation Humanising Healthcare, and the Conversation Cafe is a project that we developed over about 4 years to allow people like Eddie to share his wisdom and experience with trainee medical professionals to better prepare them to care for people with addictions when they come across them in clinical situations. This project developed and I realised that there was a massive disconnect between medical institutions, medical schools and the recovery communities. I had seen that there was a huge amount of wisdom and a culture of self-development and collective growth and collective healing that was happening out in the communities, and it was working. People were coming off their drugs, coming off their prescriptions, and they were sustaining new lives, and their well-being was better, their health was better. The Conversation Cafe is split into 3 parts. The first part, someone from the community with lived experience shares their story of addiction and recovery, and that really sets the scene for the session that is to follow. At the end of their share, we go into the Conversation Cafe, where we have 5 questions which appear on the screen, and there are 10 minutes to discuss each of those questions. The prompts that we use during the discussions have been very carefully designed to lead the conversation to the most important themes of addiction and recovery. And this has all been co-designed with the recovery community, so they've been involved in the development process from the beginning. During the discussions, the students and the people in recovery are asked to write down the main themes and ideas that come up during the discussions. At the end of the 10 minutes, we ask the students to move over to the next table. They rotate clockwise around the room, and that gives a more complete and diverse view on addiction and recovery from those different perspectives. We then collect in the post-it notes and put them up on the wall underneath the corresponding question. These are useful later on for when the students are asked to reflect on what they've heard during the session. After the last question, there is a 10-minute period to take a break where participants can have a coffee or a cup of tea and a biscuit. At the end of the break, we gather back around for a group reflection. The way the students are asked to reflect is by looking at the post-it notes and selecting 1 or 2 which resonate most strongly with them, and discussing around a table their reasoning behind choosing those 2 post-it notes. They are then asked to share their reflections with the rest of the group. And that's an opportunity for them to give back to the recovery communities who have for the last 2 hours been sharing their experience, and the students can share what they've taken home.
I enjoyed it all, speaking to all of them. They were engaged, they enjoyed it, we enjoyed it. And it's good for the 2 paths to come together and be able to share life experience. And I think it's about time it's happening, because it's good for everybody all round. It's kind of building that bridge, and I think the bridge needs to be active between the 2 recovery communities, students, doctors, whatever it may be. Aye.
One of the feelings it left me with was a general feeling of hope. Just seeing people that have made this incredible journey from suffering one of the hardest things to recover from, seeing them having actually done it, shows you that it's possible and you can have a part in it.
I think for me it's just like a better awareness of the resources that exist in our communities, things that are so vital to people's journey in recovery, and yet something that I've not really heard about before. And I think it's the notion as well is that we can all play a part in people's recovery, and you know, being compassionate can look like having a chat with somebody, but it can also be having really difficult conversations and making hard decisions, and just as a doctor being aware of what's out there that's on us to do in order to provide for the people we look after.
Our organisation is called Humanising Healthcare because we strongly believe in breaking down some of the unhelpful barriers that exist between doctors and patients, and this informal setting where students are able to have these kinds of authentic conversations with people breaks down those barriers. It's very effective at doing that, and we've had people who have come through who have said that during this time they completely forgot that the students were going to become doctors in a couple of years' time. And that's exactly the effect that we're looking to achieve, is this humanisation, and to see the commonality and to enhance empathy, understanding, which is central to good quality care.